Okay, boss. We've been sharing so much of our stories, our journey together, our experiences and so on. But I want to bring out something special for our patients, followers out there on social media. They want to know more about something that is patient-centric, insights about our experience in managing patients, special cases and so on. So, do you have any stories or something that you'd like to share with our audience?
Well, Kiru, if you ask me like that, having done this for the last 30 years, plenty of stories, but maybe I will dig back in time where we probably shared one such case. Many years ago when I first went to Taiping, there was a young boy, 8 years old.
Oh, yes. Yeah.
So he was involved in a motor vehicle accident and, had a head injury. I remember he brought to the casualty, and my medical officer called me and said there's a boy here in a coma with a head injury, 8 years old. So I was at home having coffee, so I rushed to the hospital, saw, and he was like being resuscitated because the heart was about to stop.
Yeah.
So we had to resuscitate him, do CPR and all that. Then brought him out a bit, and we called EPO. Those days we didn't have CT scan and typing.
Correct.
No facilities for removing the blood clot in the brain. So I called EPO, the neurosurgeons, and they said that it will take time to send. So if possible, do whatever you can there, or you probably have to let him go.
Yeah.
But this is the 8-year-old child, So how to let go? Our entire being as surgeons is, we never give up.
Yeah.
Whenever possible, especially in children.
Yeah.
We know how remarkably well children recover.
Correct.
And this is the type of surgery I had been doing before in Alusta anyway.
Yeah. Correct.
So I told the parents I have ability to do these surgeries. There's no time to send to EPO. If they are okay with it, then I will attempt in typing.
Yeah.
But I haven't done it in typing yet.
Yeah.
And equipments also, I'm not sure whether they work or not. So I went to the theatre. The father and mother were really crying inconsolably. They said, just please do whatever you can.
Yeah.
So I went to the theatre, operating theatre, and looked through the instrument. There seemed to be an instrument which was used many years ago by a different surgeon for this purpose. So I told him, the instrument is there, it seems to be working. Then I took the baby in. I was actually advised to let the child go.
Yeah.
Because they said that probably not salvageable.
Correct.
Doing the surgery. So anyway, against their advice, I took the child in. And then the equipment wasn't working.
I think that's shocking.
So somehow I just broke all the bones overlying the bleeding area. I pinched it out, made a hole, took out the clots, and then drained the blood clot.
Yeah.
And then sent the patient to the ICU. And during the stay in ICU, he was in ICU for about 6 weeks in a coma.
Yeah.
And he didn't worsen, neither did he improve.
Yeah.
But on the 7th week, he started waking up. I remember.
Yeah.
I think at the time you came into the department.
That's why I remember this patient as well. Because
So he started waking up and made very rapid progress and recovered. Subsequently, we sent him to a neurosurgical center to cover back the skull. All that. So we are fortunate. Now he is a chef somewhere in Penang.
Wow, look at that.
So
he is so jaundiced in Penang.
So this is the ability of a child to recover. So who are we to say, who should live and who should die? We can't, Of course, if it was an elderly person, then maybe I would have taken the advice. But that moment in time, I had to make a decision. I remember, right or wrong, you need to do this.
Correct.
So in the end, it justified. But the embarrassing thing was, they called me to the church to thank me and all that. That was the embarrassing part. But the nice part was to watch that powers of recovery, standing in the background and watching this fellow grow up, become an adult. And then the parents also become close to me. So yeah, that case will always have a dear place in my heart.
Yeah.
So it told me that never give up on any situation unless you have tried everything possible.
Yeah.
Of course, more often than not, it may not work.
Yeah.
But sometimes it does.
I think that was a very unique point in time also where, as a district hospital, we had so many limitations, Now we have a lot of referral centers where we can send quickly. The ambulances, are built to, handle trauma cases better. At that time, we had to send our house officer together with the patient. And, if, anything happens on the way, patient stops breathing or anything, then we don't have the facility to resuscitate the patient as what we have now. Yeah,
It takes about 1 to 2 hours to reach Ipoh.
Correct.
And then these are critical moments, So, but subsequent to that, we got our CT scan and we started doing this kind of surgeries in typing regularly. So yeah, he was the first one.
Yeah, I remember when you got the what they call it, the Midas Rex craniotome, to drill the hole and all that, and you should see the power of that, how it drills through the the vault of the skull. So all that was because of these cases that we had, where we were able to do it.
So often patients inspire us, So yeah.
Yeah, I think that's a.
But on the opposite side also, we also have other things, Sometimes cases don't go well.
Yeah.
So that's why I always I remember I keep telling you guys, as a surgeon, we all carry many graves inside our heart. And, from time to time, we sit back and visit these graves and see what we can learn from, These are cases which, patient died. Then we see what we have learned from that. Initially, we used to feel depressed. I remember going to my boss when I was training and telling him, I operated this patient, but, after surgery, patient didn't survive and passed away. I was feeling very bad, sad. Then my boss reassured me, don't worry, in your lifetime you will many.
Yeah.
But the important thing is you have to learn from it.
Correct.
And make sure the next patient benefits from what you have learned.
Yeah.
So that's why we always say we carry graves in us.
Yeah. It's very true. Because
I'm sure you have your own such stories.
I think if let's say that we're in a position where we do major cases and of course anything can happen, the good outcome that we share here, of course, happens to many of our patients around the world and to many surgeons as well. But we as surgeons have to understand that in scenarios where the cases don't go well, that's a situation that we have to bounce back, because the next patient is waiting for us to be at our top level to do that as well. And we can't be, of course, we do feel that sadness and that.
You have empathy.
Yeah.
But you cannot afford to be pulled down because of it, because you have to get up and go.
Yeah, that's right. That's right.
So bad cases are part and parcel of being a surgeon, especially in this day and age. People associate any complications after surgery must be because of the surgery.
Yeah, that's
and oftentimes it's not.
Yeah.
Okay, but sadly this the society we're living in, very litigious, and then there are plenty of legal people who cash in on this
issue
scenario. So sometimes I feel all this doesn't bode well for the services in the country, because there's more and more people adopting defensive practice.
Yeah.
They see something difficult, technically problematic, potential complication, they don't want to handle.
Yeah.
So what will happen if everybody does this?
Yes.
So what will the future hold for patients with complicated diseases or complex diseases, complications?
Yeah.
If nobody wants to do, then who will be affected?
Yeah.
The patients themselves.
Correct.
So the decision makers have to know that they carry a responsibility towards the advancement of medical service in the country as well.
Yeah. I think well put, Mr. Vimal. Patients nowadays should understand that when we do surgery for them, in any scenario, of course, the intent is to cure, to make them well again, as far as possible. But you must understand, every patient is different. So the outcome for someone who is fitter, not much of diseases, everything optimized, is better than someone who is more ill, coming in an emergency situation. So it's not the same. We can't equate the same. So I think there's a lot that our followers and people out there should understand.
Yeah,
Okay.
very poignant but true.
Hey guys, thank you so much for joining in this landmark episode of Dr. Kiru's first podcast, which is none other than
Borak
Sempoi with Dr. Kiru. So we're looking forward for our episode number 2, which is coming soon again. And that is going to be my favorite topic, boss, where we're going to talk about bariatric surgery.
Yeah, thank you, Kiru, for inviting me. I'm really honored. I'm hoping to see more and more of you. And I'm off to surgery now.
Thanks for joining us, boss. This is Dr. Kiru for you.